Hey guys, Tony Maritato here, licensed physical therapist. And as you guys know, I do a lot of new patient evaluations. I treat a lot of patients following a total knee replacement, but I also treat a lot of other conditions. And so one of the things that comes up quite a bit with lower extremity injuries, either post-surgical or non-surgical, is understanding what the warning signals are for cellulitis. And if you don't already know, what is venous insufficiency? So I just wanted to give you guys a quick, brief explanation of the two and then show you a couple images. This is probably, to me, one of the most important things that gets addressed during the initial evaluation with any physical therapist is they take a look at the lower extremity. They assess the skin integrity, health of the skin. They also look for excessive swelling, excessive redness, possible signs of infection or blood clots or any complications. That is more important than just about anything else we can get done on the first day of therapy. So let's take a look at this real quick. I will post a link to this website because I'm using this as a resource, but there is a difference between venous insufficiency and cellulitis. But when you look at the pictures, which I'll share at the end, so just be aware there are going to be some pictures that show a little bit of graphic scenes. They do look similar. So chronic venous insufficiency can present with a variety of symptoms, ranging from mild swelling and achiness in the legs to actually having open sores and ulcers. Venous insufficiency is a progressive disease that's caused by a number of vein disorders, but the primary culprit is the faulty faulty valves within the veins. And basically, if you understand how veins work, there are a series of valves. When you contract a muscle or you take a step or you do an activity, the blood flow, the fluid flows up back toward the heart. The valve closes in a normal functioning situation, and then the fluid cannot drop back down. So that's part of the reason why we encourage ankle pumps so much early in the recovery process, because every time you pump your ankle, the gastrocnemius, the soleus, the muscles of the lower leg are tightening. They're squeezing the fluid back toward the heart. Then the valves would be closing, preventing that fluid from dropping back down. In a situation of venous insufficiency, those valves aren't functioning properly. The fluid tends to sit in the lower leg, the foot, and starts to seep out into the surrounding tissue. Varicose veins is another problem associated with venous insufficiency. But what I want to discuss here is the difference between venous insufficiency, which is really a problem caused by valves and blood pooling in the lower leg, compared to cellulitis. So cellulitis is a serious bacterial infection of the skin that occurs on the leg and the face, but can affect any part of the body. The number of risk factors that can increase one's chances of developing cellulitis, some of which include any openings in the skin, obviously post-surgical recovery, the lack of proper blood flow resulting from chronic venous insufficiency is a factor that could contribute to somebody developing cellulitis. But it's important that we understand cellulitis is a bacterial infection of the skin, whereas venous insufficiency is a problem within the veins themselves. So I'm going to pull up a couple pictures. If you don't want to see kind of red, potentially wounds showing up, go ahead and click off the video now. But if you do want to see the difference between venous insufficiency versus cellulitis, I'm going to show you right here. So first we'll take a look at venous insufficiency. I'll go ahead and kind of zoom in here. So you can see this is, you've got the redness in the lower leg. Here's another version of it. Let me move my video so that I'm not blocking you guys. Hang on. Well, what I'll do is there we go. Okay. So now you can see some of these pictures a little bit better. Typically with venous insufficiency, this has been persisting long before the surgery occurred, long before the knee replacement. A bacterial infection of the skin that would be associated with cellulitis, that would be something that presents after the knee surgery. So now if we take a look at pictures of cellulitis, you can see here, let's see if we can find, you know, this one, you kind of have this red splotchiness. It's just a little bit different. Again, it's more of a skin problem, not a deep vein problem. Certainly somebody can have both venous insufficiency and cellulitis. A great way to keep track of cellulitis, and this is what we would do in the clinic, is if we noticed an area that we were a little concerned about, we would go ahead and mark that area and we would keep track. Now, typically what I do is I take a photo on my camera and then I keep taking photos on a daily or weekly basis just to see how the redness is changing, if it's getting bigger or smaller or changing in any significant way. Here's another kind of characteristic. It almost looks like a rash. It's not a rash, but it looks like a rash. That would be consistent with cellulitis. And then the last part that I wanted to go over, and this is coming from the Mayo Clinic website, they talk about when to see a doctor. Now, your physical therapist should certainly tell you if you need to go see a doctor if they believe there's something serious going on. Let me move this back over so you guys can see what I'm looking at. There we go. And I'll zoom in a little bit. But basically, according to Mayo Clinic, seek emergency care if you have red, swollen, tender rash or a rash that's changing rapidly, or you have a fever. See your doctor, preferably the same day if you have a rash that's red, swollen, tender, warm, and it's expanding, but without a fever. So the fever is the indication to say, hey, fever is a red flag. We need to get to the emergency room. We need somebody to take a look at this and get us started on antibiotics or whatever the treatment is going to be. If it's red, swollen, tender, but no fever, you can get a doctor's appointment scheduled, or you can communicate through MyChart or whatever you would normally do. But the bottom line is you definitely need a professional set of eyes taking a look at that. And one of the best things you can do proactively as the patient is take those pictures for yourself every single day in the same lighting so that your therapist, your doctor, your surgeon, somebody can see if it's progressively getting better, getting worse, or staying the same. I recommend all of my patients take photos of their incisions, take photos of their ankles, and then if they really want to go overboard, they can take girth measurements to determine how the swelling is doing day to day. So guys, I hope that was helpful. If you have any questions, post them in the YouTube comments and I'll catch you on the next video.